Many people only go to the doctor when something hurts, but real medicine is not reactive, it's preventive. In this video, I'll explain which medical tests everyone should do once a year and why. I'll break it down into three parts: tests for women, tests for men, and additional screenings for people over 40. This is not about overtesting. It's about catching problems early when they are easiest to treat. Let's start with women. Every woman, even if she feels healthy, should do a basic yearly evaluation. 1. Complete blood count. This test gives us information about anemia, infections, inflammation. Many women have iron deficiency without knowing it, and fatigue is often the first sign. 2. Basic biochemistry panel. This usually includes glucose, HbA1c, if at risk of diabetes, cholesterol, and lipid panel liver enzymes, kidney function electrolytes. It helps us understand how your organs are functioning overall. 3. Thyroid hormones, at minimum. TSH, free T4. Thyroid disorders are very common in women and can affect energy levels, weight, mood, menstrual cycle. 4. Iron status, iron plus ferritin. Ferritin is especially important. It shows iron storage, not just current levels. Normal hemoglobin does not always mean optimal iron stores. 5. Vitamin D. Vitamin D deficiency is extremely common and can affect immunity, bone health, mood, muscle strength. 6. Gynecological examination. Once a year, full gynecological exam, pap smear, according to age and guidelines. This is one of the most important preventive steps for women's health. 7. Breast ultrasound, echo of the breasts. Especially important for younger women, women with dense breast tissue. It helps detect changes early, long before symptoms appear. Mammogram, for women greater than 40 or higher risk. High blood pressure, or hypertension, is often called the silent killer because it usually has no symptoms. Even if you feel fine, your blood vessels and organs can be under stress. Why it matters: increases risk of heart attack and stroke, can cause kidney damage over time, often linked to lifestyle factors, stress, salt intake, lack of exercise. Men's annual checkups. Many men avoid doctors until something hurts, but preventive checkups can save lives. Even if you feel healthy, certain conditions develop silently. 1. Complete blood count and basic biochemistry. These simple blood tests give a general overview of your health. Complete blood count checks for anemia, infections, and inflammation. Biochemistry panel looks at liver and kidney function, electrolytes, and blood sugar. Why it matters: early detection of metabolic problems or organ stress can prevent bigger issues later. 2. Lipid profile. Cholesterol and triglycerides are key markers for heart disease. Total cholesterol, LDL, bad cholesterol, HDL, good cholesterol, triglycerides. Even if you feel fine, high cholesterol can damage arteries silently. Tip: regular testing lets you adjust diet, exercise, or medication if needed. 3. Blood glucose and HbA1c measures blood sugar and long-term glucose control, detects prediabetes or diabetes before symptoms appear. Why it matters: uncontrolled blood sugar can damage heart, kidneys, eyes, and nerves. 4. Blood pressure, check. High blood pressure is often called the silent killer. Even if you feel fine, hypertension stresses your heart, brain, and kidneys. Measures systolic, heartbeats, and diastolic, heart rests, pressure. 5. Urological exam usually starts around age 40 or earlier if you have symptoms or family history. Includes prostate evaluation, PSA test, and checking urinary function. Why it matters: early detection of prostate enlargement or prostate cancer can improve outcomes. 6. Vitamin D and optional lifestyle tests. Vitamin D deficiency is common in men and affects bones, immunity, and energy. Additional tests depending on lifestyle, liver enzymes if you drink alcohol or take medications, bone density if risk factors exist. Men's annual checkups aren't just about finding problems, they're about prevention and peace of mind. By checking blood, cholesterol, sugar, blood pressure, and prostate health regularly, men can catch issues early, stay healthier longer, and avoid serious complications. Annual checkups for people 40 plus. After the age of 40, our risk for certain health problems naturally increases. Even if you feel healthy, regular checkups can catch issues early when treatment is easier and more effective. 1. Cardiovascular assessment. Heart disease becomes more common after 40. Tests may include ECG, checks the heart's rhythm, echocardiography, ultrasound to see heart function. Stress test, evaluates how your heart responds to exercise, why it matters. Catching heart disease early prevents heart attacks, strokes, and heart failure. 2. Cancer screenings. Cancer risk rises with age, but early detection saves lives. Important screenings: colon cancer, stool test or colonoscopy; breast cancer, women; mammogram or ultrasound; prostate cancer, men; PSA test or examination. 3. Bone health. Bones become less dense with age, increasing the risk of fractures. Tests: DEXA scan, measures bone density, vitamin D, and calcium levels. Why it matters. Detecting osteoporosis early allows for prevention with supplements, diet, and exercise. 4. Diabetes and metabolic health. Risk of type 2 diabetes increases after 40. Tests include fasting glucose and HbA1c. Also check cholesterol and blood pressure to prevent cardiovascular complications. 5. Eye and hearing exams. Vision and hearing naturally decline with age. Early detection prevents long-term complications. Eye exams for glaucoma, macular degeneration, and cataracts. Hearing tests for age-related hearing loss. 6. Optional lifestyle tests. Thyroid hormones, especially for women. Liver enzymes, if you take medications or drink alcohol. Sleep apnea screening, if overweight or symptomatic. At 40 plus, preventive health is more important than ever. Annual checkups help you stay ahead of silent diseases, maintain energy, and live a healthier, longer life. Annual health checkups are not about fear, panic, or looking for disease. They are about awareness, responsibility, and prevention. Most serious health conditions do not start with pain or clear symptoms. They develop quietly, over years, while we feel fine. That is exactly why preventive medicine matters. You don't need to do every test available. You need the right tests, done at the right time, and interpreted in the right way. Whether you are a woman, a man, or over the age of 40, one well-planned annual checkup can help you. Detect problems early, prevent serious complications, protect your energy, productivity, and quality of life. Your health is not something to postpone for later. Spending one day a year on prevention can give you many healthy years in return. If this video helped you understand preventive checkups better, like the video, subscribe to the channel, and let me know in the comments what health topic you'd like me to cover next. Thank you for watching.